Hello, good morning, everyone, and welcome to this event organized by the European Public Health Alliance. Many thanks for joining us today for this event on the health argument for clean heating and cooking. We are delighted at IFA to be able to host the launch of a new CE Delft study, and we're looking at a very rich and exciting agenda with fantastic speakers bringing in expertise from different fields. My name is Christina Prikop from IFA, and as the moderator of this event, I will do my best to ensure the smooth running of today's session. We will be addressing the health impacts of air pollution caused by residential heating and cooking, and our event will look to shine a light on the health harms of air pollution, discuss ways to integrate health in sectoral policies, discover the role of energy efficiency and alternative heating technologies in reducing air pollution, and reflect on the role of local authorities in the transition to clean energy. Before starting our event, if I may, I will go over a few housekeeping rules, which are probably familiar to most of you, but nonetheless worth mentioning. The event is being recorded, and the video will be available afterwards on our YouTube channel. You may contribute to the debate by using the Q&A function, and we will make sure that your questions will be brought forward to the discussion. Do engage with the speakers. This will only enrich the conversation. Indeed, we are here to allow as many questions as possible. Even during the presentations, please do not hesitate to post your questions. And my colleagues and I will be constantly monitoring them, and we will bring them to the discussion. And finally, we have a live tweet for the event on our Twitter account at @IPHA_EU. And you can also share your comments with #CleanHeating and #CleanAirForAll. After these housekeeping rules, for those of you who may not know us just yet, please let me briefly introduce IFA and our work. We at IFA are a people's platform for public health with broad and versatile membership consisting of over 80 organizations, from other European umbrella organizations to the smallest of grassroots groups. Our membership includes health professionals and patients associations on the one hand, and public health authorities and research bodies on the other, but also a number of organizations that represent vulnerable population groups. We work on different public health related topics, such as access to affordable medicines, health inequalities, and non-communicable disease prevention. As a public health organization, our approach is to focus on social and environmental determinants of health and on root causes. Air pollution is a key example of an environmental risk factor where individual level changes are unavailable, inefficient, insufficient, and often all of the above. This makes coordinated policy action essential. It is with this in mind that IFA has developed its understanding of and work on indoor and outdoor air pollution as caused by residential heating and cooking. It is a topic that requires multi-sectoral collaboration and cooperation, but also increased public awareness. And with today's event, we hope to contribute to both of these. To help set the scene for the discussion, we will first start with a welcome address from Dr. Milka Sokolović, the Director General here at the European Public Health Alliance. Milka, over to you.
Thank you very much, Christina, and a very warm welcome from my side as well. Today, indeed, we will dive into a conversation about the ways we heat our homes and cook our food by bringing together expertise from very different angles. Mentions of air pollution often bring up images of heavy traffic and factories where the toxic fumes are every so often directly visible. And we rightly identify fossil fuel and biomass burning as a major cause of health damages and climate change. But somehow we have gotten used to wood and fossil fuel burning taking place in most of European homes on a daily basis. We do not question the olden ways. We associate them to the good old days when things were natural, and we do not link them to health and climate challenges, and we should. So our discussion in the next hour and a half will, as Christina suggested, shine a light on heating and cooking as a source of air pollution, while exploring technical and policy solutions at the EU and local level. Sadly, air pollution represents the leading environmental health risk in Europe, being a major cause of stroke, lung cancer, and premature mortality. And we will hear more about its health impacts and costs to society later today. In recognition of the damage done by pollution, outdoor air quality is regulated in Europe, and EPHA is hoping that the results of the ongoing revision of the EU legislation will be ambitious and reflect the latest scientific evidence. Furthermore, the quality of the air we breathe in indoor spaces has been brought to the forefront of the public conversation during the pandemic. While indoor air quality remains largely outside of the European regulatory framework, EPHA advocates for health implications to be meaningfully integrated in regulations covering all policy areas, including those for buildings and home appliances. And our session today will also explore the role of energy efficiency and alternative heating technologies in reducing air pollution. The health inequalities aspect of indoor air quality is of particular concern to us at EPHA, because vulnerable lower income groups are likely to live in smaller and more poorly ventilated homes. Thus, they are at risk of breathing in higher concentrations of pollutants. Their houses are also likely to be less well insulated and less energy efficient. And the energy transition now opens a great opportunity to make a tangible impact on people's health and well-being. Our home environments is where we feel safe and where we spend the vast majority of our time. And we expect them to protect us and to protect our health. And for that to come through, we need a transformation on the way our homes are fueled, so to say. So local authorities, being closest to the citizens, have a crucial role to play in the implementation of this transformation in a way that carefully considers people's needs, as the panel will discuss today. So let me conclude this very short welcome note by saying that it is clearer than ever that burning fossil fuels and biomass at home is not only an environmental, but also a major health issue. And we must reimagine the built environment in a way that reflects our health needs and that protects our health. And I'm looking forward to today's conversation and to the societal transformation to come. Many thanks, and over to you, Christina.
Thank you, Milka, for the introductory remarks on air quality and health. With this framing in mind, we will now continue with the presentation of the new CE Delft study being launched today on health-related social costs of air pollution due to residential heating and cooking in the EU27 and UK. CE Delft is an independent research and consultancy organization leading the field when it comes to energy, transport, and resource issues. We will hear from Marisa Korteland, the lead author of the report and a senior researcher at CE Delft, working with them for the past 15 years. Marisa brings substantive expertise on policy evaluations, including impact assessment, social benefit, cost-benefit analyses, and environmental pricing, among which CO2 pricing. It is my pleasure to now give the floor to Marisa. Marisa, though.
Yeah. Apologies for that. Good morning to you all, and thank you for giving me the opportunity to share some highlights of our report. I have a short presentation to share with you. So our study is on the health-related social costs due to air pollution that is emitted by residential heating and cooking. Today, I will shortly give you some background information on why we started the study, what were the reasons for that, share some details about the research approach, highlight main results of the study, and indicate what further research is needed. And finally, if you have some questions, you can also ask them now in the chat or afterwards, or you can send me an email. Just a short introduction. Christina already told you about CE Delft, so I'm going into the report right now. The main reason for starting this study is because cooking and heating cause air pollution, which means a damage to human health. If we look at the policy debates and policy decisions, we see that often economic indicators are mainly used for the rationale behind policies, and important environmental aspects and their impact on society are often ignored or less considered because they don't have an economic value. So in our report, we try to adopt a social cost approach, which means that we value the adverse health impact to society of air pollution in this case. And a social cost approach is an approach which takes into account a loss in economic welfare. And it means that we take into account the healthcare expenditures of illness, like hospital admissions, but also people's loss of working days. And we consider indirect health impacts, which means that people face discomfort because of diseases. They face increased mortality risk and reduced life expectancy due to all kinds of illnesses. And all these impacts are taken into account, and they are valued in a financial manner to make sure that policymakers review them as well when deciding their policies. The social costs we use differ per country because people are willing to pay to avoid all these negative health risks, but it also depends on their income level. And of course, if you look at population density in countries, it's obviously that the more people are in a certain area, the more people are affected by air pollution. Then some things about our research approach. We calculated the health-related costs to society of 7 air pollutants that are emitted during home heating and cooking. Then we looked at direct pollution at home, which arises when fuel is combusted in your home. And for some heating and cooking options, they use electricity and heat, which is not produced at home, of course, but at generator plants. And to allow for a fair comparison, we also looked at the emissions at those electricity and generator plants. We considered the health-related cost for the EU 27 and UK as a whole, and introduced some case studies related to Spain, Italy, the UK, and Poland. Our main result are the total cost estimates stated in euro per year for each country or region. And it means that we valued the total annual emissions shown in Eurostat with the cost figures. Well, I started my introduction with telling you why we needed to do this research. And the main reason is that when no financial value is attached to certain impacts, they are usually not considered equally into account with economic values. So therefore, we adopted a social cost approach, showing loss in economic value due to, in this case, air pollution. We take into account the direct expenditures of people, like hospital admissions, loss of working days, but also the indirect health impacts, which are usually the most important ones because people really have discomfort due to diseases and also due to lower life expectancy. We calculated those costs to society, and they differ per country because countries differ in income level, but also in population density. And of course, when there are more people in a certain area that is highly polluted, more people get affected and the health costs will rise. Next slide, please. Then a short note on our research approach. We included 7 pollutants in our analysis. Looking at direct pollution at home in case there is fuel combustion at home, and looking at indirect pollution when the heating techniques are based on electricity or collective heat. We considered the European area and UK, and also 4 individual countries, Spain, Italy, UK, and Poland. And the main result is an estimate of total cost estimates expressed in euro per year, which shows us the total annual emissions in the areas combined with the social cost estimates I mentioned before. Next slide, please. And of course, the question is, if you have a total amount of social costs, what are the contributions of each technique fuel combinations? So we also looked into that. and we show certain fuel techniques. How do they account for the total costs, and also looking at individual techniques, what are the cost of using them. So we used emission factors of those techniques and social cost estimates to show how polluting or how clean a certain fuel technique combination is. And just to attach more context, because people are not familiar with terms like gigajoule output delivered and things like that, we translated those figures into annual cost per average household, just to give people some idea about what we are talking about in terms of costs. And finally, we also looked at some alternative options like hydrogen, hybrid heat pumps, but also heat pumps that fully run on clean energy, and to see in what way switching to these alternative options could reduce the health cost. Next slide, please. Now I arrive at the main results. I mentioned the total cost to society. We calculated that those costs are about 29 billion for the EU region and UK as a whole. The direct pollution impacts are the most important ones. They amount to 27 billion euros, and a relatively smaller amount is related to the production of electricity and heat at production sites to deliver energy to electric and heating options. I also included the figures for Poland, Italy, Spain, and UK. You can find them in the table, but due to the time, I will continue to the next slide, please. Then we made a differentiation of the total costs and shown that in the European region as a whole, wood stoves and coal boilers are the main important ones in terms of social related costs. And this is always a combination between how many appliances of that type are used for now in the EU region and their cost in terms of air pollution. And both wood stoves and coal boilers are very polluting ones. So they have a relatively small share in total final energy consumption, but due to the high pollution levels, they still account for relatively large amounts of the total costs. These results are also shown in the case study countries. We found that in Poland, coal boilers are dominant in total cost shares. And in the other countries, particularly wood-based techniques are responsible for the main social costs. Next slide, please. Then we also looked at individual fuel technique combinations. As I mentioned, we translated the results in terms of household cost per year. And we show again that coal boilers and wood stoves are highly polluting, so result in relatively high social costs, and gas boilers are in between with 30 euros a year for a household, and heat pumps, they are the cleanest ones included in this presentation. They have a cost to society that relate to 10 euro per household per year. And those 10 euros is due to the fact that heat pumps use electricity. And because at the moment electricity is not produced in a polluting-free way, there are still emissions arising. And therefore, the impact of heat pumps is not 0, but 10 euros per household per year. Then we considered how to reduce the costs of air pollution by heating and cooking. Well, first of all, we considered alternative fuel technique combinations, looking at hydrogen, the green ones and the gray ones, looking at heat pumps and hybrid heat pumps. So combining electricity-based heat pump and a gas boiler as a way in between. And also, if you green electricity, then and heat production, indirect emissions are lowered. So that also helps to make heating and cooking more sustainable. Because comparisons with transport are frequently made, and you just mentioned that in the political debate, there's also a lot of attention for transport and less for heating. So to give a rough estimate and some indication, we also estimated the annual social cost of a diesel car, and it's about 210 euros per household per year. So you see that coal boilers and wood stoves have much higher results in that case. In the report, you can also find the individual results for all alternative fuel techniques, but due to the time, I left them out of this presentation. But afterwards or during, I can also go further into that if you want. Next slide, please. This is what I wanted to show you, but I think due to the time, it's not the most relevant part of the presentation. So I will skip this slide if you agree and can come back to that later. Then I'm arriving at some recommendations for further research. I have shown you what we estimated in terms of health-related social costs based on outdoor pollution only, while we recognize that indoor pollution is very important as well. The main reasons for not including indoor pollution is that its impact depends on many factors, and since our result is based on a high overview of various techniques and things, we cannot go into the situation at homes in particular situations. For example, looking at ventilation, at the space in house, the time spent people indoor, the food they cook, all things like that have a high impact on indoor pollution. And as a second one, we need a method and underlying data to quantify the additional impact of indoor pollution. And if you simply add indoor pollution and outdoor pollution without a good methodology, you might have double counting. So that's the reason why we point out that it's very important to look at indoor pollution, but we didn't include a quantified result in that regard. So further research on that subject is highly needed. Please, next slide. This was, in short, our research report. It was very interesting to conduct it, and I hope you will find the report interesting as well. If you have any questions about this presentation or report, please don't hesitate to contact me. So these are my the information about me and where you can reach me. Thank you.
Many thanks to you, Marisa, for the presentation and for telling us about the very interesting findings of the report that will inform our conversation today. And while quantifying health harms is an immensely difficult task, the figures you presented are very helpful to gain an intuitive understanding of the magnitude of the problem that we are facing. And hopefully it will give us an impetus to act and enact the changes that are needed. Now, I want to encourage everyone in the audience to please post their questions. I do see one coming up, and then Marisa will be staying with us for the duration of the event, so she will be able to answer questions later on as well. But seeing this already posted in the chat, Marisa, the question is, how is the data for the study obtained? Do you have any comments on the reliability of the data?
Yes, I have. With respect to the total emission estimate, we are highly confident that it's reliable data because the emissions come from Eurostat, national emission accounts. We adopted a social cost approach based on extensive literature and our experience. Of course, in our research, there's also a level of uncertainty, which is quite common when you make assumptions and things like that. We also included it in the report. So if you want to know more about our assumptions and things we doubt about, you can find it there. With respect to the division of total cost to the individual fuel technique options, there's some more uncertainty because it's very difficult to know what kind of fuel and techniques are actually there in the countries. So there's a little bit more of uncertainty there. But we still feel confident that these results indicate the broad, how do you call it? They indicate the right way. You know, there might be a small change in numbers, but in broadly we fully can support the things that come out of the research.
Thank you very much for the answer. And I think it is important to point to data gaps and future need for research. And again, Marisa, thank you for staying on with us. And we will have a chance to come back to the study during the last Q&A session at the end of the panel conversation. But for now, we will move on to the panel discussion with our 4 speakers who will be delivering short opening remarks, and then we will proceed with the conversation. So our first panelist is Professor Zorana Andersen, Chair of the Environment and Health Committee for the European Respiratory Society and Professor in Environmental Epidemiology at the University of Copenhagen. Professor Andersen's main research areas include health effects of air pollution, where she's leading several projects on cardiovascular, respiratory disease, cancer, and dementia. She's also passionate about advocacy on clean air and translation of knowledge from research on health effects of air pollution to policymakers at local, national, European, and global level. So Nana, thank you so much for being with us here today, and please, the floor is yours now.
Thank you very much, Christina, and for EPHA for inviting me to this very important conversation. And thank you, Marisa. I really enjoyed your presentation and this report, and I welcome very much this report quantifying in a very detailed way contribution of this very important source of air pollution and the cost in EU. I think in general we lacked more understanding and quantification of effects of household wood and coal and fossil fuel burnings on health. A lot of our health studies mainly focused on traffic earlier, so I think this is a very important contribution to our better understanding that this source is still very dominant in Europe, and also to understand these differences between countries and context on which sources are most important, and how, of course, to go about reducing impact air pollution on health. So I present European Respiratory Society Environment and Health Committee, where I'm chairing. So, of course, my main points today are about health impact. And as Milka pointed out, this is not environmental problem, or it's really, we're mainly concerned because this is a health issue, and I think we cannot either separate anymore environment and health. I think now with climate change, we're moving toward that understanding on one health. We are part of our environment, and environment directly affects our health, and I think we understand that more and better. I have a few comments on the report. The estimation of health impact and the costs presented this report. I apologize for a little background noise here. It shows the enormous health cost of this source, which we already know. We know the overall impact of air pollution in Europe, as this report brings up, over 300 deaths a year, and many more people that daily get sick from number of diseases, cardiorespiratory diseases, metabolic, children, elderly, and so on. I want to point out to several facts. The one that this cost, although huge and unacceptable, it's actually already underestimated. We know the dose response functions, the estimates used for impact, for example, on mortality that are presented in this report are already a little bit outdated. And now with the WHO new air quality recommendations that came out just the last year, we know that we understand now for the newest studies that came out in last decade or so that health impact of air pollution is actually larger than we previously known, and a lot of new estimation now at EU level will use this new exposure response functions, which show actually larger impact of air pollution on health. So we'll see a larger number of people dying from air pollution, and that will impact these calculations. Another reason these estimates are although huge underestimated is also that we know that air pollution affects more health outcomes that are also listed in this report. We have really enormous solid evidence coming out. As I mentioned, air pollution increases risk of number of respiratory diseases. Me presenting European Respiratory Society, we know that respiratory patients are in the center of burden. They understand, they feel immediately impact of air pollution and affecting the lungs, causing chronic and infectious respiratory diseases, asthma. The newest evidence on COVID-19 air pollution is also disturbing and showing how huge burden of air pollution is. We also have very new evidence and solid evidence, as we know, that air pollution affects metabolic diseases, diabetes. We have fast emerging evidence on dementia and impact of air pollution on our cognitive ability and cognitive function, also cognitive development in children. So this fast emerging evidence from our excellent research also show that also these estimates on morbidity outcomes are already partially underestimated, and it will just increase in coming years. So this is just reason to do more about it. Third point I want to make, and Marisa pointed this very well, this report focuses on impact of household heating and cooking on outdoor air pollution, but we still lack means and methods to estimate direct impacts on indoor air. And many times it was pointed on report, indoor air pollution concentrations can be really very high and often unequally affecting especially women who stay more at home, pregnant women, young children, elderly, retired citizens, many with chronic diseases. So these are also not counted here, and adding those, of course, there will be some double counted. Right now, they're underestimated. And of course, we need different research methods to understand this impact, but just understand that they are still not presented in this report. And finally, also mentioned in the report, the fossil fuel burning for heating and cooking is one of the major drivers of climate change, and indirect impact of climate change on our health is also not counted here, but it's very important. We know now that we have this unprecedented climate change impact on our environment, on our health, and indirect effect through increased exposure to heat events, temperature, to extreme weather events, which we have witnessed in Europe, from flooding to wood fires, to droughts, to storms, and so on. Which affect also air pollution and pollen exposure and so on. They are also not counted, and also we need more research to understand the overall impact of climate change in coming years. So my short point, of course, it's a very important report. We have a huge cost to health. This is the reason that we need to do more about this source of air pollution now. And this is just extra support to ongoing legislation in Europe right now under the Vision Air Quality Directive, that we need stricter air pollution legislation, and especially with help of this report to understand how to tackle air pollution from household heating and cooking. We know that any reduction in air pollution from these sources will have immediate benefits for health of Europeans. So I'll stop here, and thanks again for inviting me.
Thank you very much. And thank you for highlighting some very important aspects about the impacts of indoor and outdoor air pollution, and that while we are all exposed to air pollution and our health is being affected by it, some of us may be even more vulnerable than others. Now, for the intersectional conversation that we have promised for today, we have a diverse panel with expertise from different fields. And our next panelist will then be Dr. Richard Lowe's from the Regulatory Assistance Project. The Regulatory Assistance Project is an independent, non-governmental organization dedicated to accelerating the transition to a clean, reliable, and efficient energy future. Richard is a senior associate based within RAP's Europe program. He's a specialist in the technology and policy associated with heating, with over 10 years heat policy experience in industry, academia, and working with policymakers. Richard, thank you for your participation today, and I will now hand it over to you.
Many thanks, Christina, and thanks for the very kind invitation to come and speak here. I'm not an expert in air pollution, and I'm not an expert in health at all. And I've been focusing on heat decarbonisation really for my whole career now. And I'm leading some of the regulatory assistance projects thinking around that, and specifically focusing on how EU policy and member state policy can also support the move towards sustainable heating. So to start off really on a personal note, I previously lived in London, which is one of the most polluted cities in Europe. And moved to Cornwall, a county in the southwest of the UK, which is very different to London, and very clean air, very rural. And the difference you notice on a personal level is incredible. In London, I'd walk to work or cycle to work, and you'd be breathing in bus fumes or breathing in general air pollution. And it was just one of those things that was very matter of fact. Whereas now living in a rural area, I can smell when a single car drives past, or I can tell whether it's a petrol or diesel car. And so clearly, I think a lot of these things we take for granted, but it's an invisible pollution in many cases. And from my work on heat decarbonisation, I think what we've seen also with some of the work from the US that's looked at internal air pollution is that the evidence is increasingly pointing towards the damage caused by internal air pollution and pollution from heating, not just from transport. And there's a real bulk of evidence now growing. So where does the clean energy angle come in? Well, firstly, we know that for our climate change targets to be met and for renewable energy targets to be met, that we've got to reduce the amount of fossil fuels that we burn. And actually, with biomass causing such a significant share of that pollution, so people burning wood in stoves, we also know that we've got to reduce the amount of biomass that we burn as well, because in many cases, biomass isn't actually sustainable. It may be no more clean from a greenhouse gas emission level than coal. But while biomass is particularly sort of dirty from an air pollution perspective, we also know that we've got to get rid of all of the gas and oil that we burn in our heating to meet our air pollution goals. And central to that, actually central to removing off fossil fuels and heating, are heat pumps and our technologies such as heat networks, which don't involve any combustion at the point of the heat. So naturally, if you move away from gas and oil boilers, you will reduce air pollution. And it's just a sort of a lucky coincidence that by stopping burning stuff, you meet the climate change targets and you also can reduce air pollution too. And from a sort of economic and policy perspective, the billions of euros and billions of pounds that have been recognised in this analysis, which show the cost of burning biomass and fossil fuels for heating, we haven't factored them into our analysis about moving to clean heating. And actually what it means is that while we already thought that moving off gas and oil might be cost effective for heat decarbonisation and for getting towards our clean energy targets, we need to now factor in the value of the air pollution benefits from doing that as well, because increasingly the value of moving to clean heating is being recognised, not just from the carbon benefits, but also from the air pollution benefits, as well as things like the import reduction benefits that I'll come back to later. So specifically in terms of policy at the moment, the Fit for 55 package, which I'm sure many of you will have heard of, is a key policy intervention by the European Union and led by the European Commission to boost renewable energy, to ensure that the climate change targets are met. And it's a significant window of opportunity. And a recent piece of analysis that I've been involved with at RAP, which has also included other organisations, including Agora Energiewende, has been looking at how that package will support heat pumps. And we are optimistic that the package as proposed will actually provide significant support for heat pumps. So clearly, European EU policy is going in the right direction when it comes to heat pumps, but it's not going far enough and it's not going quickly enough. And there are some significant interventions in there which could be further strengthened or could be modified. Interestingly, one of the specific recommendations we made is actually about reducing the levels of biomass used to meet renewable energy targets. So we've proposed a cap on bioenergy, but there are multiple different elements of the Fit for 55 package, which we have proposed could be modified to further speed up the rollout of heat pumps. And the context of this, the current context of this is also incredibly important. Because rolling out heat pumps doesn't just reduce carbon emissions and doesn't just reduce air pollution emissions, but it also reduces gas demands. And in the past few months, certainly since gas prices first went up last year, the interest in heat pumps has grown significantly. And that's because installing a heat pump or a heating system based on heat pumps, such as a heat network, will significantly reduce the amount of gas that is used and therefore the amount of gas that we have to import. And just looking at my example in my house, I calculated that from switching my gas boiler, which I used to have, to a heat pump, it's reduced the total demand of gas for my house, because we still use some gas to produce electricity. It's reduced the total amount of gas by 82%. So heat pumps not only have air pollution benefits, carbon benefits, but also now have geopolitical benefits too. And I started on a personal note, and I'll finish on a personal note. I do now live in a fully electrified house. I have an induction hob and I have an air source heat pump. And the air source heat pump provides a very nice health benefit in that the house is always a steady temperature. And this is combined with energy efficiency too. But my internal temperatures mean that there's no risk of real condensation or damp, and certainly no risk of mold. And where I live in the UK is a particularly wet and damp part. It tends to rain nearly all of the time, I think. And the final big impact is the switch from gas cooking to an induction hob. And the biggest benefit, again, is associated with humidity and internal moisture. And having the induction hob means that we really never see any sort of internal moisture and steam, because there's no gas being burnt in the house to produce moisture. And actually, cooking a roast dinner or any other sort of lengthy meal used to be an affair that would result in lots of steam and condensation on windows. And now we just don't get that anymore. So there are huge benefits from switching to clean heating, not just heat pumps. And I think it's great that EPHA has done this work. So thanks very much.
Thank you to you, Richard. It was really great to hear that personal note, as it is always essential to be reminded of the actual direct impact that these policies have in people's lives. And it's also great that you pointed out the co-benefits of the energy transition for health, for the environment, for society. It is a complex issue to which EPHA is aiming to make its contribution from the perspective of health and of the health community. Which is why we have also recently drafted a position paper on clean heating and cooking, and we are following the latest policy and legislative developments at the EU level in particular. And having said that, it is my pleasure to introduce the next speaker, Mr. Pau Garcia-Audi, who is a policy officer at the European Commission's Directorate General for Energy, DGNR. He works in the B3 unit, which is the one unit in charge of energy performance of buildings directive, energy labeling, and eco-design. Within the buildings team, he covers the areas of energy performance certificates, inspections, and standards. So it is really great to have you as part of the panel conversation today, and we are very much looking forward to hearing from you. Please, the floor is yours.
Thank you very much. Well, I'll start by saying thank you for inviting us here today, and also try and share the presentation. It's just 2 very small slides. Let me know if there is any problem. I like the personal note from Dr. Richard. I have to say, unfortunately, I'm in the opposite situation. I grew up in an area that has excellent air quality because it's very, very windy. And nowadays I'm living in Brussels, so it's not exactly an ideal situation. But yeah, whenever I go back to my hometown, it's great to be able to breathe some fresh air. So right, moving into the work we are doing in the Commission. So I work mainly on the energy performance of buildings directive, which promotes the improvement of the energy performance of buildings and the reduction of greenhouse gases from buildings. So even though we don't actually regulate through the EPBD directly on air pollution, it still has a very significant effect on what comes out of buildings. So basically, the less heating we need, the less we pollute, but also the cleaner technologies we use in buildings, the less pollution that comes out from them. In December last year, the Commission made an ambitious proposal to revise the EPBD. This is just one of the pieces in the Fit for 55 package, but well, personally, I believe it's one of the key pieces because buildings are large consumers of energy in the EU. They represent 40% of the energy consumption and 36% of the greenhouse gases emissions. So whatever we do in this area has a very significant effect. In terms of what the EPBD or what this revision of the EPBD does, it has 2 main objectives. The first one is to contribute to the greenhouse gases emissions and final energy consumption targets by 2030. But then, so it has a very clear short and medium term effect, but then it also has a long-term effect because it aims to provide the long-term vision and already the measures to already start working on a decarbonization plan for the building stock by 2050. In terms of the specific measures, I'll highlight some of them. Please bear in mind that this is just a snapshot. I can't go into the detail, but the EPBD can broadly be, the revision of the EPBD, sorry, can broadly be described in 4 different focus areas. The first one is there is a clear focus on renovating the building stock because the vast majority of the building stock in the EU, first of all, is very energy efficient. It has been standing for many years now. And second, it will still be in place by 2050. We renovate very, very slowly and we rebuild very, very slowly. So most of the buildings that are here today will still be here in 2050. So we need to do something about them. There are a number of measures to support renovation. The first one is the introduction of minimum energy performance standards. This is a measure that aims to trigger the renovation of what is considered the worst performing building stock in Europe. So those buildings that are in the lower EPC categories, energy performance certificate categories, sorry, will need to be renovated by 2030 and by 2033. Other measures that we include, for example, the improvement of energy performance certificates or the development of national building renovation plans to really support the renovation of buildings. In other areas, the decarbonization of the building stock, for example, we introduced the zero emission building definition, which will be the new standard for new buildings and for renovated buildings. For buildings that undergo very, very deep renovations. We also start considering the whole life cycle aspect of the building, so not just the energy that it consumes during its operation, but also the energy that it consumes while being built and while being demolished. And then, perhaps most important for today's discussions, we introduce measures to incentivize the phase out of fossil fuels. So, for example, incentives for financial incentives for fossil fuels in buildings, so installation of boilers, for example, will need to be phased out by 2027. But we also make it easier for those member states that want to introduce outright bans on the installation of fossil fuel boilers. So it's easier for them to do this. Another area is we also are very conscious that as we renovate and build new buildings, we need to modernize them. So, for example, we introduce new measures on infrastructure for sustainable mobility that really works on the integration of buildings with the electric vehicle market. We make it easier to charge vehicles, which has a knock-on effect on the pollution of the transport sector. We also introduce new measures to make it very visible how technology advanced or how smart buildings are. And finally, also quite relevant for today's discussions, we introduce measures on indoor air quality. So for new buildings and for renovated buildings, there are some obligations on the need to monitor and control indoor conditions. So CO2 levels, humidity, but also, for example, volatile organic compounds and things like that. So they need to take these things into consideration. And last but not least, just to mention, there is a very important package of measures looking at finance, because we are very aware that all these measures that I've discussed until now very much require people to spend money to renovate their buildings. And so we need to make this, we need to make cheap finance available as much as possible. Thank you. And looking forward to the discussion afterwards.
Thank you very much. So are we, and indeed some very important EU initiatives and legislative files currently being discussed and revised. And we are very grateful for your insights into the EPPD and the impacts that it may have. We will certainly come back to this during the Q&A session. But for now, as the energy transition will not only require involvement from experts in different policy areas, but also from actors at different levels of governance, we are very glad to be able to introduce our fourth panelist representing local authorities, Patricia Ponka from the Association of Municipalities Polish Network Energy Cities. The association is a non-governmental organization working on local sustainable energy policies and climate protection since 1994. It represents Polish local authorities, mainly municipalities, but also municipal companies and associations. Patricia is project manager working within the association for the past 13 years and a thematic expert in resource efficiency. Her main fields of interest include energy efficiency in buildings, energy awareness raising and change of consumers' behavior, energy efficient infrastructure, and adaptation to climate change. Patricia, you'll be wrapping up the series of introductory remarks. So just a kind nudge to our audience to submit their questions and maybe also indicate who they are being addressed to. But for now, Patricia, the floor is yours.
Thank you very much, Christina. Good morning to everyone. My name is Patricia Ponka, and like Christina said, I'm project manager at the Association of Municipalities Polish Network Energy City. We are a non-governmental organization that is supporting Polish cities in energy transition for over 25 years now. We are supporting Polish cities in the development, implementation, and monitoring of local energy and climate strategies. We promote energy efficiency and use of renewables. We implement different kinds of projects that support energy transition of Polish cities. We organize thematic conferences, seminars, workshops, and study visits. We very much support exchange of experience, exchange of the good practices between Polish and European municipalities, as we believe that such exchanges inspire municipalities to implement new energy and climate-related activities on the ground. We also help in finding sources, financial sources for the implementation of different energy and climate-related projects. We are basically working around all energy and climate topics, one of which is the topic of air quality improvement. As probably most of the people in this virtual room are aware that the air quality topic is a very important topic in Poland, as our cities, our regions are one of the most polluted regions in Europe. And this is not only the data, but also the thing that we see every time we go out in the winter from our homes, go out for walks, go out to work. So we can see that the air quality is very poor in most of the regions. One of the key, let's say, sources of this situation are low stack emissions from individual boiler houses that are fueled with poor quality coal, or even, which is shame to admit, with municipal waste. So what we are doing in our work is that we try to support Polish municipalities in tackling these issues, in changing the situation. Of course, dealing with air quality, improving air quality requires solutions at all levels. But what we can see as the association working with municipalities is that the municipalities have special role to play. They are the closest to the citizens. They know their situation the best, and they have tools to act to improve the situation. On one hand, to improve energy awareness, health awareness of the citizens, and on the other hand, to provide them with concrete support for changing the situation. So there are various things, various tools that the municipalities can do to work on the air quality improvement on their territory, starting from implementation of legal solutions through implementation of some financing solutions. So, for example, contribution to the financing of the replacement of the heating source. They can act also on the educational level. They can act on the energy consultancy level. So there are a lot of things that the municipalities can do to improve the situation. But I will not go into detail right now. I will leave it for the second part of the debate. Thank you very much for the introduction.
Thank you, Brigitte. It was very important for us to hear from local authorities and the perspective and what is being already done. Hopefully we will get a chance to address some more of these points in this part of the discussion, which we're now opening the discussion time, the most interactive part of the webinar. So I will invite all panelists to join me for this. And we have already received questions. I will encourage everyone to keep submitting them. The first one, just chronologically, Marisa, I think it was addressed to you, as it was still sent fairly shortly after your presentation, and it was about the health effects from gas boilers and where specifically do these come from, and it was in reference to slide number 9.
Yeah. Okay, well, thank you for that question. We looked at the impacts of individual techniques by considering the emission factors, so showing us how many emissions are polluted for a certain amount of energy delivered. And we added a financial value to it based on a social cost approach. And the emission factors are obtained from the EEA.
Thank you. I don't know if anyone else would like to add anything on the impacts of gas boilers and their effects. But Otherwise, we have more questions coming in. So the next one is, to what extent is it possible to distinguish the impact on indoor air quality / health between emissions due to cooking or heating and impacts from dampness and cold? So there are many impacts that may be considered as overlapping. And the question is, how is it possible to distinguish between them? If anyone would like to take that one, maybe Professor Anderson, if you'd have some remarks about this.
Sure, thanks for a good question. I think this illustrates the difficulty of studying indoor air pollution, because all these sources, exposure to emissions from all these sources is mixed, and so we don't have such a good studies to distinguish between these exposures. We do know individual effects of whether it's biomass burning from experimental studies, what they do to our health, or whether it's from coal burning. We know how mold and dampness impact what outcomes for respiratory patients, so on, as well as this gas cooking. So in that sense, we understand what they do biologically, but it's not so easy to distinguish for them if they occur in the mix. Plus, we need also studies to better quantify what exposures indoors, and that would require quite major measurement campaigns indoors and so on. So this question illustrates very well why it's much more difficult to quantify specifically indoor exposures on health and outdoor, and which this report addresses as well.
Thank you. Maybe a follow-up to that is whether the priority should be fuel switching or improving ventilation and building envelopes. Now, this is how the question is framed, whether one needs to be prioritized over the other may be a point for discussion.
Is this for me?
If you'd like to continue on this.
Well, I think it's not either or. I think improvements in all levels are definitely necessary in sense of prioritizing. Yeah, I think definitely this report points out in how much there is to gain from certain types of fuel to another. So it depends where you are. I think definitely that's a priority. At the same time, improvement in buildings, both in isolation and ventilation are necessary. So I think all of these are necessary to start with. It's not a question either or for me. Maybe Richard wants to.
Yeah, sure. I think it is both. There's a question over timing, of course, and so there are, I guess, if you think we need to remove fossil fuels from heating by 2045, perhaps there are 2 appliance cycles left. So by that, there are 2 appliances. So if you have a gas boiler now, it might be your last one or your second to last one, if that makes sense. It's certainly, if you're switching to a heat pump, it can be made easier if you do energy efficiency at the same time. It's not always a requirement. But the complexity is that houses are so different. So if you live in an apartment that has shared ownership, that will be very complicated. If you live in a house, it might have solid walls, depending on where you are in the world, or it might have cavity walls, which have already been treated. Some stuff you can line up and you can do at the same time. So it might be easy to, for example, have your cavity walls filled or have your windows replaced with better windows at the same time as having a heat pump fitted. But it really depends. I think what this really says actually is that when people are looking to renovate their homes and buildings, there needs to be a system there that allows them to do everything at once if necessary. And what we're not very good at is actually, and this is in the UK, but also across the world, is joining up these packages. Because in many cases, you can do a lot of stuff in one go. So you can have your insulation upgraded, you can have your windows upgraded, and you can switch to a low temperature heating system like a heat pump. And it might be easier to do that all in one go because you can join all of the bits together. And so these packages can be really, really useful. But it depends. It's complicated, I'm afraid, is the answer to the question.
Thank you very much for unpacking that process and making it, more understandable and less sound like less of a burden to people, because it is a big project usually when one engages in such renovation, and it's important that we make it as easy as possible. Patricia, did you want to come in as well?
Yes, actually, I would like to comment. Thank you. I agree with the speakers before. What we need to do is to work on both aspects, both levels. Like I mentioned before, in Poland, the poor air quality is mostly related with the low stack emissions from individual and inefficient boiler houses. But actually, such individual and inefficient boiler houses are often, let's say, are most often found in homes which are also poorly thermally renovated. So these things are just combined. People who live in too big uninsulated houses, they usually have also old and inefficient heating systems. So this is the things that we should both work at the same time. And here we can see the let's say responsibility on the national, regional, and local authorities to support these people, both from the, let's say, financial and from the educational perspective. So, for example, there are already examples of national and regional and local funding programs that co-finance thermal retrofitting and replacement of heating sources in individual households, especially those falling under energy poverty. So this is something that should be done, but it should be also combined with the educational and awareness raising activities, increasing people's not only energy awareness, but also awareness regarding managing their budgets, managing their resources. So there are I would say, actions that should be a priority, but all these actions should be combined to really support the transfer. If we change the heating source in a house that is not thermally retrofitted, it doesn't really bring a good result. Even if we provide people with some good technologies, but they don't know how to use them efficiently, it's also not right. So we should work on all these levels, some financial support, some technical support, some educational support, and working both on thermal retrofitting and on switching to new, more energy efficient sources, which both these aspects have impact not only on the environment, but also on the human health and the health of the neighbors.
Thank you very much for highlighting how everything, yes, needs to come together and fit together so that we make efficient changes. I will make use of my privileges as a moderator to pick up on something that Patricia mentioned, and also something that Milka raised in her remarks, and would like to ask from the professional experience of the panelists what appears to be the current level of public awareness around heating and cooking specifically as a source of air pollution and as associated with negative environment and health impacts. Because Patricia was raising this point around the need for awareness campaigns. I was wondering if you've seen the current levels of public understanding regarding the health impacts from heating and cooking, rather than, as was also mentioned in the discussion, transport, for example, or factories. Professor Anderson.
Sure, I can bring some insights from Denmark, Copenhagen, and we talked a little bit before the session started. In Scandinavian context, wood burning for heating is unfavorably cheaper than other sources of heating. There's no taxation, so this puts wood burning in a position that a lot of people favor because it's cheap, but also because culturally wood burning indoor fireplaces have the cultural context of coziness, which is more or less expert now with Danish lifestyle and Danish design and so on. So definitely in Denmark has been hard to talk about wood burning as an environmental health problem, and compared with traffic, it's everybody understands that traffic is major maybe impact for adverse health effects. I think there's both political and from citizens kind of that negation of accepting that wood burning is something bad, because it's a lot of members, people have it, wood burning around fireplaces, bonfires are positive. So there's a lot of that cultural context that is just has been hard both to bring out political will and communicate the adverse health effects of wood burning in Denmark, for example. And when we put also the relative source of PM in Copenhagen, for example, there's a very large fraction of wood burning. I think it's very hard to go on with it. So there's definitely the cultural context and barriers and perceptions that something cannot be that bad for you as smell of diesel and wood burning. There's just this cultural Scandinavian perception that this cannot be that bad for you as something coming out of cars. So I think definitely information and then changing some public and cultural perceptions need to be introduced here, because they are related to political will and to do something about it, if it's popular or not popular. And then right now I'm in Belgrade, of course, in Eastern Europe, the realities are completely different with energy poverty, and this is not just a matter of choice. So I think report also points out very nicely the different contexts in different countries and regions of Europe, how to go about. But information is definitely step one.
Thank you, and I would like to echo that as originally Romanian. I think, yes, considering the differences across Europe is also very important. Paul, did you also want to come in on this question or the previous one?
It was for the previous one, but I can also say something on this one. Our information suggests that yes, awareness is growing, and there is this increased perception that buildings matter and what's being done in buildings is important. Generally, when we talk about air pollution, people tend to think more about pollution from cars, for example, than from particularly diesel lately. But there is this growing perception that yes, buildings also matter. However, at the same time, what we do notice is that there is a lack of information about what can people at individual level do, meaning like, okay, I want to improve my building. What can I do to improve my building, and how do I go around it? We joke but it's not a joke. It's actually true. They say that building renovation is one of the most complex things that you can do in your lifetime. And to a certain degree, especially those of us living in Brussels, it's certainly the case. So, but the importance of information is very it cannot be underestimated. The other issue that I would like to highlight, and that Professor Joanna, sorry if I pronounce your name wrongly, but what you mentioned, the differences in the starting point or the perception between member states, between regions, is very very important. It's not the same when we're talking about renovating buildings in a southern member state or in Greece, for example, than we're talking about a Scandinavian country or Poland or Ireland. The perception is completely different, and the difficulties are completely different.
Thank you. To stay on the legislative perspective just for one more minute, we also have a question on what is the role of source legislation such as eco-design to phase out health-damaging heating and cooking appliances, which if you'd like to take on as well, Paul, please.
Sorry, could you repeat the question? I didn't.
Yes.
There was a bit of a noise at some point.
Oh, apologies. What is the role of source legislation, such as eco-design, to phase out health-damaging heating and cooking appliances?
Well, that's. I mean, in terms of eco-design, it provides very clear criteria for limiting the number of pollutants that goes that are emitted by different appliances. So, for example, in the case of solid fuel boilers, it provides very specific limits on the number of particulate matters, but also on the NOx emissions, etc. Please bear in mind that I'm not an expert on eco-design. I'm in the team that works on eco-design, but I don't work on eco-design. However, I think it's also important to highlight that there are different pieces of legislation working together. So there is the eco-design that provides very clear limits on individual products, but then there is also the EPBD, which provides very clear limits on the performance of buildings, so how much energy we can use and how many emissions we can emit for buildings. And that also goes together with other EU, national, regional, and also local legislation pollutants, for example, or on the levels of pollutants at local level. So I think it's also very important to bear in mind how the different pieces of legislation integrate with one another.
Thank you. I think that very smoothly actually goes to the next question, which is to Professor Andersen, and is what are some key recommendations for the revision of the Ambient Air Quality Directives when it comes to, I mean, air pollution, heating and cooking in particular, given the conversation, but, you know, air standards in general?
Yes, so we are in our community very much advocating for support to the newest WHO air quality recommendations, air quality guidelines that recommend the limit values for all major pollutants, PM total mass, NO2, PM10, and so on, to lower them significantly from current EU legislation values in order to protect health. This is based on, of course, evidence on the health effects of all of these major pollutants. So these WHO guidelines have come out for European Commission as a synthesis of our evidence on health effects, and we from health community, epidemiological community, support fully implementation of and adaptation of WHO recommendations for EU policy, and we believe these should be the new limit values if they are really intended to protect human health. We see from WHO report that air pollution, really there is a no lower threshold really there's a no lower value of air pollution that is safe for health all the way. And meaning that majority, almost 99% of European population is exposed to air pollution outdoors that is dangerous to our health. Of course, this is directly translated to indoor air pollution as well. So we cannot distinguish in this type of studies the sources. This is for total PM2.5 mass, total NO2, NOx, but this of course intuitively tells us that we need to work on all sources equally. There is no before we know better, we know that all PM, all particles, no matter where they come from, are dangerous for our health. So full support to much stricter legislation, and we directly support implementation of WHO guidelines as soon as possible. As I said, because of such a large scale, such an large impact, and unacceptable burden of air pollution we have in the EU, and because everybody's exposed, I think we need much stricter EU regulations. Right now, as we know, at current EU limit values, many countries comply with those, but we still see major health effects even below the EU limit values. So they're clearly not working and not protecting health as intended. So that's our clear policy, and WHO guidelines do not distinguish between different sources because clearly we do not have enough evidence to distinguish which sources are most dangerous. But any reductions in any sources emissions will clearly have health benefits. So that's our clear message. I hope that answers your question.
Very much so, and again would like to echo that as an EPHA position as well on the importance of the latest scientific evidence being taken into account, and the fact that there are no safe levels of air pollution, and that we would hope that the legislation reflects that and keeps being updated as more information becomes available and more studies are being undertaken.
If I can add to that, we have the European Respiratory Society together with the International Society for Environmental Epidemiology recently published a statement in the full support to WHO guidelines, and we have a very unique situation where we have included a number of other medical communities for the first time. We made alliance with European Society of Cardiology, European Cancer Society, and then soon after American societies, American Thoracic Society, American Heart Association, and many others around the world. We have over 80 public health medical patient organizations have supported this statement. So this was quite unique support from health community at large, not just respiratory as earlier we've seen, but now cardiology societies, cancer societies, and we'll see more are really recognizing this is really a public health or health emergency. And yeah, I can send a link to that statement. I think you've seen it, but this has really mobilized uniquely number of medical and patient societies, which understand that this is a really health emergency we have.
No, that it is great to hear that such efforts are being mobilized, because indeed it is essential that we hear from the health community about these impacts. Now, to move to a different question that I have spotted in the chat. The question specifically is, given the scientific knowledge about this theme, how can the wood and pellet stoves in Italy still tax deductible? Now, it's a difficult question to answer. How come are they still tax deductible? But maybe an insight into how to move on from having such tax policies. Maybe that would be a way to approach this. Richard, would you like to address this?
I'll try my best, although I have to be honest, the Italian tax policy isn't my speciality. I mean, I think there's 2 points to this. So one is that the reforms going through the Commission at the moment around the Fit for 55 package could do a lot here. And so I'll just go back to the question around eco-design, which is actually relevant to all of the three prior questions. Eco-design could potentially be used as a stronger tool. At the moment, it ranks appliances, and the re-ranking that's proposed alongside the Fit for 55 package will effectively make anything that burns anything. Gas and oil systems, it will make them look relatively poor from an efficiency perspective. And so that should provide some, I guess, communication or some insight to consumers around the need to move to more efficient technologies such as heat pumps. But we think it could be made stricter, and you could increase the requirement that any new heating appliance has to have an efficiency above 100%, and that would naturally lead to people only putting in heat pumps. But that only applies to, or that element of eco-design only applies to central heating systems, so those connected to heating systems. And so there will be separate rules needed for standalone appliances like wood-burning stoves or like single-room heaters. I think the interesting sort of policy question is that the Commission has said that it's not within their sort of remit or their experience to do technology bans. And I think that's just a position that could change, because if something clearly a technology such as wood burning or gas burning or oil burning is something that the whole of Europe needs to see removed, then I think that's a position at the Commission that could move. And on the actual specifics of the tax issue, there are changes afoot also as part of the package, the Fit for 55 package under the Energy Taxation Directive, to shift taxes on heating fuels so that they do reflect the carbon emissions. And hopefully that will happen, although that does require unanimity of all member states to approve that. And so whether it gets through is yet to be seen. But that re-ranking could naturally mean that the fuel inputs for producing heat would be ranked according to their environmental impact, and would naturally point people away from the heaviest carbon and therefore the heaviest air polluting appliances. Although how that then becomes taken in at member state level, and whether that would mean things like tax deductible appliances are accepted, would be yet to be seen and would be decided at member state level. But there is lots that can be done to have these sort of trickle downs from European EU policy down to member state policy as well.
Thank you for that. Luckily, we have a representative of the Commission who might be already able to address some of the points that Richard mentioned in his answer. If you'd like to.
Yeah, not an easy one, I have to say. Sorry. No, perhaps just comment that on the technological neutrality, because that's a very tricky issue. And for example, on the EPBD, we have to be very, very careful about it, because it links to the one of the reasons it links to is the common market rules, and you cannot establish barriers to commerce. So it's, to be perfectly honest, I don't understand it completely, so I have to be very careful. It's not my area, but I know it links to the common market rules. So you have to be very careful on how you set rules, because if something is produced in a member state, you shouldn't then not be able to sell it in another member state. So it's about setting up common rules rather than specific rules. That's the general line. In terms of eco design and energy labeling, actually we had seen some movement by member states that they were looking into ways of banning fossil fuels, which is one of the reasons why, and they were doing a little bit what you mentioned, like they were going, okay, we ban any products that are D class or E class outright. So it's not about banning fossil fuels as such, it was banning the less efficient appliances, which of course, it's very, very difficult to make a super efficient coal burner. It's almost impossible. So it was not a backwards way of working it, but a roundabout way of working around it. So one of the things we've done in the EPBD is we've made it easier to member states to set up fossil fuel bans outright. And we also banned the use of public funds for the replacement of heating appliances using fossil fuels. But yeah, it's a very complicated issue, I'm afraid.
I think we do have a consensus around the table that it is a very complicated issue, and to bring again the perspective of the local authorities, and I would like to ask Patricia about the type of additional support that they might think would be important or useful in implementing the energy transition, and also maybe some reflections on the main challenges from the perspective of local authorities.
Thank you. So regarding the challenges, this is something that probably we could speak about for hours. Of course, like I said before, in our opinion, local authorities are the closest to the citizens, so they are the most fit for supporting the citizens in changing, improving their situation, also in increasing their energy awareness. I would say that there are the three key areas that they can act. One area is the legal area, so implementation of local regulations that would support switch towards decarbonizations, support removal of old and inefficient boiler houses. We have already examples of such, for example, legal acts, local legal acts, like the local legal act in Krakow that banned all fossil fuels, all solid fuels since the 1st of September 2019. There is the second area that is the financial area. So usually the people who influence the air quality the most are the poorest ones. So they need financial support to change their situation, financial support to switch from old and inefficient heating sources to more ecological ones. And the third one is, like I already mentioned, awareness raising not only concerning the resource efficiency, the health and environmental impacts of using bad quality fuels, but also awareness raising concerning available support schemes. There are numerous support schemes available on the national, on the regional, on the local level that can help people to switch from poor quality fuels to the better ones. But people usually are not aware of them, didn't heard of them, or need support for applying for funding. So these are the three areas where the municipalities are working on, and the three areas that I would say they need support. So they need some stronger legal frameworks on the national level that would allow them to implement local regulations influencing the situation. They need some financial support from the national also level to implement own local financing scheme supporting those most vulnerable energy poor households in switching towards new fuel source or doing the thermal renovations. And they need also some training support, some educational support, both from the national level and from the, I would say, other stakeholders, non-governmental organizations that are dealing with the topic of energy. We can see that more and more municipalities decide to implement energy and climate managers, but these people need training, these people need education, access to material, access to other people's experiences to manage the situation on the local level. There is a very good practice in the Małopolska region where eco-advisors have been hired in several municipalities of the region and support citizens in building their energy awareness, but also in getting funds for energy investments, in checking their individual energy situations. The eco-advisors provide energy consultations to the citizens. We believe this is a very good strength of actions, but to make this regional, let's say, good practice available, moving towards the national level, we would need some support, also financial support, for example, for hiring such managers in cities, but also educational supports to train them very well. Regarding the eco-managers in Małopolska regions, they have been doing an over more than a year study that has been prepared by a few universities from Krakow concerning technical, economical, and also social aspects. So they are very well prepared to do their job. But in other municipalities in the region, we can see that sometimes the people are hired for the position, but are not so well equipped with the capacities, with the knowledge. So this is something that we think is important to be changed. So to give this knowledge and capacities to people in municipalities that should work with the citizens, should work on the energy topics. And also as an association of municipalities is working on many international projects, we see that it's very important to support the exchange of experience, networking, exchange of good practices between municipalities from different regions, so that they could inspire each other for action, encourage each other to take action, and also learn from each other how to support the citizens in a good way, what mistakes to avoid. So I'd said that, these are the key strengths concerning the support that the cities need to better tackle the situation on their local level.
Thank you so much for the intervention. And I think it is really good to end on a positive note, noting what has been done already, but also with a call to action as to what should and could be still done. And with that, I will be wrapping up today's event. I would like to thank everyone for their contribution and commitment to this event. We have had a very lively conversation today that I hope we will continue later on. And thank you very much for your valuable time. As we said earlier, you can follow the future developments related to this area of work. You can expect the event recordings in your mailbox, and we will update the event page as well. There will be plenty of actions and EPHA plans in the area of health and air pollution. So you can follow us on Twitter and find out more about future plans. And we are very much thankful for today's event and everyone's participation. And we're looking forward to seeing you again at our future EPHA events. Goodbye and have a good day.